The next screening that we will discuss is a newborn hearing screen. It's important to remember that hearing screen became universal in many countries in the past 10 to 12 years. And it's very important because deafness, which is picked up within the first 3 months of age, has better outcome in terms of early intervention and support to the family as well. So not all deafness is picked up because some deafness may develop over time. But if there is a family history of deafness, if the child has received gentamicin or similar antibiotics, if there is a risk of infection in the baby at birth, if there was a high level of jaundice, these babies should definitely get the hearing screen. But ideally, all babies should get the hearing screen. We have 2 tests which can be done, the otoacoustic emission or the auditory brainstem evoked response. Most of the units use otoacoustic emission, but if otoacoustic emission is failed initially, you can do an ABER, or you can repeat the otoacoustic emission and go for the ABER after some time. The otoacoustic emission is a quicker test and the baby doesn't need to be sleeping. The disadvantage is that if the fluid in the inner ear, middle ear is there, it can falsely cause a negative result. So it works by sound stimulating the cochlea, which results in the outer hair cells vibrating. This vibration produces a nearly inaudible sound that echoes back into the middle ear. The sound can be measured with a small probe inserted into the ear canal. Hearing loss greater than 25 to 30 decibels will result in no otoacoustic emission being detected, so this will mean the baby failed the test on that side. You can also get a negative result if there is blockage of the outer ear canal due to flakes or the vernix obstructing it, or the presence of middle ear fluid. Damage to the outer hair cells of the cochlea can also produce a failed test. So it's important to reassure the parents of any baby with a failed test in the beginning, and we can repeat the test after 2 weeks or so, or do an ABER. Majority of the situations, 90% of the failures in the beginning are false failures, so they pass the test, but it's important to repeat it to make sure we pick it up. One important point to remember is that if we just go clinically, we may miss unilateral deafness or a lower level of deafness. So parents may say my baby is responding to sound or winks when the door closes, or we speak to the baby and so on. But a single ear hearing will result in the same response. So unilateral deafness will not be picked up unless you do the hearing screen. So this is an image showing the otoacoustic emission being performed on a quite a happy baby.